and welcome to Cut to the Chase with Senator Chase. You've tuned into our weekly call-in town hall and radio show. That's right. It's a call-in town hall with your state representative, so feel free to call in. The number here today is 804-454-1366, 804-454-1366, and you can ask your question on the air right here, right now. We've been talking about healthcare for the last couple of weeks because I feel like this is probably when we start session back on January the 10th. This is probably going to be the biggest issue that we contemplate in the General Assembly other than the budget, which is very much a part. Medicaid has very much been a part of that, the new budget that came out this past week from Governor McAuliffe. So I'm spending a lot of time talking about this because it seems to be the silly season right now, and some people, I think, just need to be reinforced on why do we say that we support Medicaid expansion? Why are we against it? What are the arguments out there? And I just want to let you know why, I guess, the direction that I'm heading on this, and I stand and I do not support the expansion of Medicaid. And I will tell you why I think it will be not a good idea for Virginia, as I have been the last couple of weeks. And I've asked Nancy Piata to join us today. She's the executive director. She was on the show last week. She's with Virginia for Quality Health Care. And, we need to not just be the party of no, the Republicans. We need to be the party of yes, too. And so we have a number of solutions that we want to put before the people, and, feel free to call in today. But I think a lot of times we have, like last year, we passed the direct primary care bill, and a lot of people, a lot of doctors I'm talking to, a lot of you all haven't heard about that. So it's important that we talk about that, and we're going to be talking about that on the show today. So I want to go ahead and get started because I know Nancy has to leave at the bottom of the hour. Nancy, are you there?
I am. Yeah, thanks. Thanks for having me back.
Well, I appreciate you coming back. I know we had a good show last week, and we presented a number of different options. And we talked about a number of different things, direct primary care. And there were a couple of different alternatives to Obamacare that we did not have time to talk about. So I want to go ahead and get started on those. Two of those that we didn't get to talk about. One is health sharing, and the other one is a direct pay model called the wedge. And so I'm just going to open up the floor here and let you tell us a little bit. Let's start with health sharing and inform our listeners a little bit about that.
Okay, sure. Well, health sharing is where individuals get together. They pull together their resources and cover each other's expenses. And so there's no insurance company involved, and prices for this kind of direct pay model are generally lower. And I'm sure people have heard of MediShare and Liberty Share. Those are two that are advertised quite a lot. They have a religious foundation, so it's like-minded, faith-based people who join that. But there's which is great, and I've heard a lot of people really like those arrangements. There's another model that's not faith-based, and so if somebody would prefer to go that route, I would refer them to a program called Health Excellence Plus. Health Excellence Plus. You can just search for that. You can Google it, and it'll come up. But they're actually their approach is compliant with Obamacare, so that you don't have to have an exemption you don't have to have a hardship in order to use this program. And your monthly costs are about half of what a normal insurance policy would be. And so that puts more money in your pocket. You can also have a health savings account with this program, Health Excellence Plus. So it's very attractive, and there's an added bonus for my organization, Virginians for Quality Healthcare, because if every referral that we get triggers a donation from Health Excellence Plus. It's a small donation, but it does help. So I'd encourage people to look at that. It might be right for them, and yeah, so.
Very good. So health sharing is, like you said, it's not insurance. It's not an insurance company, but you basically pull together individual resources. Now, is it kind of like, I'm from the banking industry, so I'm thinking of a credit union where you have people with a similar affinity.
Right.
We had like the Newport News shipbuilders group. Could you potentially have a health sharing group like that? Or are these the only three that are out there?
No, I think there are a lot of them out there. If you just search or Google health sharing, there'll be others that pop up as well. But certainly the faith-based ones are the ones that are advertised enough or a lot. And these aren't just small organizations. They have Health Excellence Plus has over 300,000 members nationwide, and I think the health sharing, like MediShare, I think they have similar, maybe even more members. But the way Health Excellence Plus works is the individual gets a credit card, gets a Visa card, and when you have a medical expense, you just pull out your Visa card and pay for it. And so, anyway, and it's too detailed to go into how that money gets, reimbursed and so forth. But it is very attractive. And
very good. And I know my former chief of staff actually wrote the language into Obamacare to allow this exemption for the health sharing, interestingly enough. And so I've heard about the health sharing, the MediShare part of it, more of the faith-based organizations like MediShare. But I'm glad to hear there's one, because one of the big questions that I had when Congressman Bratt and I had our town hall was, what about those who are not looking for a faith-based organization? So Health Excellence Plus is the way to go. Okay, for those.
Right.
So, very good. And you said that the premiums are typically about half that of regular insurance.
Yeah, I think they advertise that you can save at least $500 a month. At least $500 a month. Of course, it depends on if you're an individual or a family and so forth. But the savings are definitely considerable and significant.
Now, if someone is considering this option, health sharing, and they're like, wow, what do I have to lose? What is the downside, or what are the challenges that you can identify for health sharing?
They do have an initial waiting period if you have a pre-existing condition. And I don't have the exact language in front of me, but I think you might have to wait a year to have an expense fully covered, a medical expense fully covered. But they do have people who will sort of interview or ask you questions or answer your questions.
So that's a good question. If someone had fibromyalgia, for instance, before. Going into this, is that something that would keep them from being able to get the health sharing?
No, I think they can still join it, but it's a question of how much would be reimbursed for those pre-existing conditions.
Okay, very good. Okay, so that's that. So that makes sense, and that's been one of my having a finance background. I said one of the things that we've had to look at whenever we're talking about federal subsidies, whenever we have individuals who are higher risk because they have, pre-existing conditions, then the insurance industry has typically been able to take that risk into consideration by charging higher premiums to offset the increased costs that they're going to have to pay because the person has an increased risk of having whatever sickness, illness, or disease, and that's going to cost more money. So that's how they handle that then is, I guess, reduce benefits for that particular illness. Is that kind of how they do that?
Yeah,
okay.
I guess you could say that, yes.
Okay, so so if you're healthy, this is the way to go. Now, I know a number of people are saying, well, I have a pre-existing condition. I have diabetes. I see that a lot, especially in the aging population. Which would be the best way for someone to go through, the wedge or health sharing? What would be the right route for someone with that?
Well, the wedge it's also a direct pay model. It's not related to Health Excellence Plus, and it's not health sharing either. It's a model where you and your doctor are in charge, and there's no third party, which in this case is kind of similar. But the wedge puts the doctor and patient in direct control of everything. So there's complete transparency in pricing. You have freedom to choose your doctor, and what I like about it is the patient's privacy is protected because there's no government reporting, since they don't follow Medicare or Medicaid rules. They don't have to abide by those regulations.
Nancy, we'll be right back with Nancy Piotta right after the break. Stay tuned. We'll be right back. Well, thank you for tuning in today to the town hall called Cut to the Chase with Senator Chase, and I'm State Senator Amanda Chase here to take your calls today. The number is 804-454-1366. It's 804-454-1366. Healthcare is the number one issue that is important to Virginians, according to the exit polls. More and more Virginians are not able to afford quality health care, and how are we going to solve that problem? Effective January 1, as we've talked on the show, those who do actually have health insurance will see their premiums go up an average of 60%. Healthcare and health insurance is becoming increasingly more affordable for most families. This is a bipartisan issue, and it's probably predominantly what we're going to be talking about this session. So I really do appreciate Nancy Piotta, who's the Executive Director for Virginia for Quality Health Care, providing us alternatives. And we've discussed health sharing as one of those options. And the next option we're going to talk about, we touched on it at the last segment, about a direct pay model called the wedge. And the creator of the wedge is a lady by the name of Twyla Braze. Did I say her last name correctly?
Braze.
Okay, it was easier than what I tried to make it. Who is a nationally recognized leader in health freedom. So in a recent op-ed from Forbes about, we've talked about Ohio and how they expanded Medicaid and all the issues that they've had with their budget. They're actually considering moving to a direct pay system. This proposal seems very exciting, but if successful, it will bring down the cost of health care substantially, at least in Ohio, because health insurers will have to adapt to a market-based paradigm. So, we're looking at other options, and let's talk a little bit about the wedge. Can you Nancy, give us an overview of what the wedge is? What is a wedge?
Well, a wedge is a piece of the healthcare system, I guess. Representing doctors and patients. And so there's a very small wedge that exists right now. If you imagine a circle and take a small wedge of that, that represents the people who have found market-based health care through a direct patient-doctor relationship without insurance. And the patients are happy and the doctors are happy. The wedge wants to transform the whole sector so that wedge grows larger and larger until the whole circle is full of, in the future, of these direct pay, cash only arrangements.
And it's really interesting because you really don't hear a lot about it. You basically hear one of two options. You hear to expand Medicaid or not, and that's it. Right.
That's right. So there are wedge practices. That's just kind of a shorthand, but there are wedge practices all across the country. It is a growing movement, and it's real simple to find out more information and to find out if there are wedge practices near you, so to speak. The website is jointhewedge.com. Altogether, jointhewedge.com. And the nice thing about the wedge, and makes it different from direct primary care, is that it includes all kinds of practices and specialties. So you can have orthodontists who, have wedge practices, or dermatologists, or oncologists. You can have a whole array of medical services. And so in that way, it's different from direct primary care, which just focuses on, primary care, as the name says. So So it's really, this is something that we're promoting. And I think as direct primary care grows, I think it'll be easier for doctors to, look at this model, the wedge, and, consider transforming their practice into that. Well, you mentioned Ohio, and I think one of the candidates for governor in next year's election has proposed this, this converting the whole state's system to direct primary care, and so I guess that we won't know until a year from now whether that's going to come about. But it is very appealing and very exciting. And I was just reading a handbook that was published this week by the Thomas Jefferson Institute for Public Policy, which is here in Northern Virginia, and it's the Handbook of Healthcare Reform, and it has essays on all different aspects of healthcare, and including direct primary care. And I'd like to explore with someone how to incentivize physicians, primary care physicians in Virginia, to convert their practices. So,
it's interesting that you would say that, because I know that was one of the ideas that you had sent me in an email that we could talk about. How do we incentivize physicians to convert their practices to DPCs or direct primary cares, and if there could be some type of a form of a significant tax credit. I know a number of doctors that I've talked to are very frustrated with the insurance companies, feeling like they're dictating them how to practice medicine. It's not the model that we had even 10 years ago. I mean, it's changed. I mean, doctors are leaving the practice, or they're selling their business to these, larger organizations to handle all of the paperwork. It's interesting. Obamacare has more than 132,000 pages of Medicare regulations and onerous contractual requirements from corporate healthcare plans that have intruded to the confidential patient-doctor relationship. And that's why we're seeing a lot of these healthcare costs skyrocketing. Things that maybe cost, $20 a couple years ago now are costing thousands of dollars. But, the doctors are frustrated. The patients are frustrated. I went to the doctor 2 weeks ago, and it's almost like you look at the physician's face and they're good people. It's almost like they're on a treadmill and they're in your room talking to you for maybe 3 minutes and then they're on to the next patient. It's just not the way that I think is good for anybody.
They're on to filling out forms. Well, electronically. I've heard that physicians spend twice as much time with the electronic data requirements as they do with the patient. And so we have to help doctors break out of this trap. And there are plenty of good options out there. We just I think if we could incentivize them somehow, it might help speed things up. But this report that I mentioned from the Jefferson Institute, it said that direct primary care was tried in Washington State, I believe it was, for Medicaid patients. And it was hugely successful. And not only did it save the state money, but it also improved the health outcomes of the Medicaid beneficiaries. So saving money and having better health incomes, it sounds to me like Virginia might want to look at how Washington State did that. But I think, I know we're almost out of time, but I think Virginia, before rushing into Medicaid expansion, which I hope we never do that, but we need to look at the experience of other states because, and I think we just need to have we need some fresh ideas instead of, running to the federal government for help for every little thing.
Absolutely, Nancy. Well, Nancy, thank you so much for coming on Cut to the Chase today. We really appreciate all your work in this area, and we'll hopefully have you back on the show later this year. Thanks for coming on.
Sure, I'd love to. Thanks so much.
Thanks so much. Take care.
Bye.
Welcome back to Cut to the Chase with State Senator Amanda Chase. And boy, so much has happened this week. I don't even know where to begin. We're going to go back. We're going to take a break from talking about quality health care in Virginia to just talk about what's going on in the House races. Was at an event last night with Speaker-elect Kirk Cox. I'm still going to call him our Speaker-elect Kirk Cox until I have reason not to. As many of you know, everybody's kind of sitting on those of you who follow politics, I know, are kind of sitting on the edge of your seat waiting to find out what's going to happen with that House seat. We at one point had a one-vote Democratic victory in the Newport News area House of Delegates race, which turned into a tie yesterday, creating an unprecedented scenario in which control of the House will be decided by state officials, basically drawing a name out of a hat. Of course, this took place in the 94th House District, which is currently held by Republican Delegate David Yancey. And saw him a couple days ago. We've had so many meetings at the state capitol. But anyway, it entered a recount on Tuesday. It initially had a 10-vote lead over Democrat Shelley Simons. And at the end of the recount, and I'll tell you what's happening, and it goes back to these things called provisional ballots, which we've talked about on the show. And what's happening is whenever you have the Scantron, you have the optical scan, and people bubble in which candidate that they want to support, and it goes to the machines. If you don't follow the directions, it's not going to count your vote. And so what happens is whenever they go through a recount, they're able to see basically they have to interpret people's intentions. So we've had people to circle the name of the person that they were supporting. We've had them X through the bubble and not fill it in. A lot of people that were not following directions whenever they were told to bubble in the circle. So, all of our teachers out there who are trying to teach you to fill in that bubble for the test, this was a test. So shout out to all of our teachers out there who are trying to teach us to follow directions. It is an important life skill. And anyway, so this is what's happening. So the State Board of Elections is having to interpret the intent of these provisional ballots. So that's what we have going on. And one of those votes initially had been tossed out, but it did show, basically long and short of it, one of those votes basically looks like it's going to go in favor of Delegate Yancey. So now they're tied again. Okay, they're tied. And what do you do in a tie? Well, according to the law, it is quote unquote determined by lot. And so we've had a number of different ways in which races or the order in which people's names appear on a ballot are determined by lot. It can be by straws. It can be by a flip of a coin toss, a glass bowl with put people's names in there. But we have so much at stake here, more than just one particular, House of Delegates race. This is going to determine basically who holds the majority, the Republicans or the Democrats, or is it going to be split in the House? So, so there's a lot on the line right here. I mean, we're basically determining here in Virginia the direction our country's going to go. It may be all decided by simply flipping a coin or drawing a straw. It's really crazy. Now, from my sources tell me that this is basically going to take place next Wednesday. Apparently, we have a number of our State Board of Elections staff who oversee this who are out of town right now on Christmas vacation. So we're going to wait till next Wednesday. So stay tuned, and we'll be talking about that some more next week, I'm sure, with next Thursday coming up. So what I want to talk to you about, and I texted Congressman Bratt, and I think he's busy voting right now. I know they've got the big vote coming up today on the stopgap bill, and I just wanted to quickly talk to you a little bit about the tax bill. I know President Donald Trump is excited, as well as his fellow Republicans there in the Hill. celebrating passage of the $1.5 trillion tax overhaul Wednesday. And this is a historic event. It is probably the biggest tax overhaul in a generation. And we're going to go to a break in a minute, but when we come back, we're going to talk a little bit about the implications, the different layouts of the taxes and all that. But the tax bill is now prompting companies to offer bonuses, which I think is great, and hopefully that will continue by other companies. But the whole point of this bill is to get our economy going. A lot of these businesses have for years, because of our tax structure, sending their money to other countries and keeping their corporations abroad. So stay tuned. We'll be right back as we talk about it.
Lately, I've been losing sleep, dreaming about the things that we could be.
Well, don't lose too much sleep, because we're going to try to make sense of everything that's gone on this week so that you can sleep. I know I want to sleep as well. So let's just go ahead and talk about this new tax reform that's taken place and what that means to the everyday average person listening here on the radio station. So first of all, I want to begin by saying that the signing of this bill actually may be postponed until the start of the new calendar year in order to delay $120 billion in automatic cuts to popular programs such as Medicare and to spare Republicans, honestly, from having to explain them in the next election year. So I'm glad that they're doing that. I think that's a smart move. The tax package provides a deep cut in the corporate rate from 35% to 21%. Now, some people are on the other side are a little critical, and they're saying, why are you reducing the corporate rate? Okay, well, here's the reason. As I was saying before the break, our corporations are leaving. They're leaving the U.S. and they're going to other countries. We need to bring them back. And unless we lower our corporate income tax rate, they're going to stay abroad. They don't want to pay all those taxes. So let's bring our money back. Let's bring our jobs back. And that's what we have to do. So I think in a sign of goodwill, you've got companies like Dallas-based AT&T, so that they would pay a $1,000 bonus to 200,000 workers once the tax bill passed Wednesday and is signed into law. You've got Comcast saying that they're going to give $1,000 bonuses to more than 100,000 employees. Wells Fargo said it's going to boost its minimum wage to $15 an hour, as well as donate $400 million to nonprofit and community organizations. And Boeing is in there too, saying they're going to provide an additional $300 million for job training, facility upgrades, and charitable giving. And I know a good friend of mine who we had this discussion in the car. She was driving me to an event. And we were having this discussion about corporate rates and the importance of having low corporate rates and how, not every company is going to do this, but it provides the incentive to, and I appreciate these companies for doing that. On the individual side, about 80% of you are going to get tax cuts. You probably won't feel it until about February, and there's about 5% who are going to pay more, and that's according to the Nonpartisan Tax Policy Center. So let's just break that down. So if you make less than $25,000, you're going to see an average tax cut of $60. Now, that doesn't sound like a lot, but those who earn between $49,000 and $86,000, you're going to see about $900. And those in the top 1% of income earning more than $733,000, they are going to receive a significant tax savings as well. They said it would be $51,000 in tax savings. The cuts will come at a price. The Congressional Budget Office predicts the legislation will add $1.4 trillion to the national debt over the next decade, 10 years. But our thought is, and I think this is what happened when Ronald Reagan was in office, is that it stimulates growth, it stimulates the economy, and gets things going. And so that's the hope there. So I think this is a good move at this point. We've got to stimulate the economy. We've got to get our money back in our country. Later this afternoon, the federal lawmakers are going to work to secure the stopgap spending bill. And I think that's where, let's see, I'm looking over here. Congressman Brad is still on the floor so they're talking about a potential shutdown clock ticking toward a deadline at the end of this Friday. And congressional Republicans are scrambling Wednesday, that was yesterday, to finalize a must-pass spending bill. So what they're doing is they're working to make sure they pass it. And the last note that I got is that would take us through January 19th, and that's from Congressman Bratt. And then they're going to have to basically start all over again. So, yeah, it's a little crazy there. I like Virginia, how we pass a 2-year budget, and I hope we do it on time this year. So I know one of the things that we'd been looking at was CHIP and getting that funded. I know that's something that they're still working on. So there you have it. It's been an interesting week, let me tell you. I'm going to give you the number again. It's 804-454-1366. Feel free to call in if there's anything that you'd like to comment on. Otherwise, I'm going to go back to what I was talking about at the beginning of the show, is the Medicaid and the Medicaid expansion. I'm telling you, this is going to be the top issue that we talk about during the General Assembly when we start in a couple weeks. Medicaid, for those of you who aren't familiar with it, it's a program of medical aid designed for those unable to afford regular medical services, and it's financed by both the state and the federal governments. Medicaid expansion is this. Medicaid expansion refers to the expansion of the Medicaid program through each state. And they did that through Obamacare or the Affordable Care Act. And it will establish a minimum income level to be eligible for the financially weakest people in America through creating a minimal Medicaid earning eligibility level requirement. Medicaid was originally intended for those who are not able to work, disabled, the children with intellectual and physical disabilities, the weakest among us who financially just can't take care of ourselves. And so, they're looking to change the purpose of Medicaid. I'm very thankful for, one thing that I did not mention is that this federal tax reform takes away that mandate that you have to purchase as an individual. You have to purchase health care and insurance, which I'm very glad to see that go away. And as we've talked earlier, just because you don't have health care insurance doesn't mean you don't have access to health care. There are still ways, as we've mentioned on the show, through direct primary care and other ways that you can still have good health care. So take a look at the areas. I was talking to you all earlier on the show last week about community health centers. And the health care law has expanded funding to community health centers, which provide primary care for actually millions of Americans, but you don't hear about them. And I was just curious as to the closest HRSA health center to my house, and there's one at the Bermuda Medical Center, which is here in Chesterfield off Bensley Commons Boulevard. And so even if you have no health insurance, you pay what you can afford based on your income. And they provide services that include checkups when you're well, treatment when you're sick, complete care when you're pregnant, and immunizations and checkups for your children. So, there are other opportunities that are out there. And the other thing that it includes is mental health, substance abuse, oral health, and vision services. You can contact the healthcare center organization directly. You can confirm the availability of specific services and to make an appointment. If you don't have any coverage, you don't have to pay the fee. And under the law, most people, they used to have health insurance, but now hopefully they're not, or pay the fee. Even before the law that passed yesterday, you don't have to pay that fee. If we haven't expanded Medicaid, which we have not. So stay tuned. We'll be back for the final segment of Cut to the Chase. Stay tuned. We'll be right back. We are on the final segment of Cut to the Chase with State Senator Amanda Chase here. And I hope you've enjoyed the last 3 weeks of talking about, honestly, why I feel like it would be a really bad idea for the Commonwealth to expand Medicaid. I think it's okay to expand waivers for those who are severely disabled, intellectual disabilities, but to expand it to the point to able-bodied people, that is not the intention of Medicaid. And what happens is those people who really need it, need the health care, are not going to be able to get it. So very concerned about that. We can look at the states that have already expanded Medicaid and are experiencing crisis, like Massachusetts, Ohio, Arkansas, Illinois, Kentucky, Michigan, Washington, West Virginia. I mean, the list goes on. Friends, we don't have to expand Medicaid to see what's going to happen. We can just watch other states that have. If you look at Massachusetts, as a federal share of Medicaid expansion shrinks, Massachusetts seeks to move adults off Medicaid and limit the drug coverage. It's just, I have a degree in finance, and it's just supply and demand. It's unsustainable what they're trying to do. And I think they're really good-hearted people that are really trying to take care of people that can't take care of themselves. And, I'm a compassionate person as well, and, never want to see anybody suffer, but there are options that are already out there, already available. And so we just need to maybe have some type of marketing campaign to show those opportunities that we already have out there. I don't want to see our budget blown apart. I mean, that's basically what's going to happen. It's going to blow a hole in the Virginia budget if we expand Medicaid. And yes, I understand we will get some federal monies, but we're not guaranteed, and we don't really know how much that's going to be. We don't know when they're going to take that away. And similar to the CHIP program, where we're kind of dependent on the federal government to refund that CHIP program, or Children's Health Insurance Plan or program, if they take that away, the state of Virginia basically has to pick that up or face discontinuing all those children who are on that program. It really does put us in a bad place. So anyway, we're going to continue to explore options. I'm going to continue with my healthcare cost transparency bill, which, as we've talked about on the show, is in every other industry. The cost before you choose to buy either a car or whatever service you buy. You have an estimated price, except for in healthcare. And we really do need to change that. If you have insurance, you're asked to sign the dotted line saying that you're going to pay whatever health insurance doesn't pay for. And most of the time, you have no idea what the estimated cost of service is. Would you sign a blank check and give it to your doctor? Absolutely not. But you know what? That's basically what we're doing. And I want to give the patient, the consumer, the opportunity to know how much before they commit to services. So stay tuned. I hope you all have a Merry Christmas. And yes, I did say Merry Christmas. Hope you all have a good one. And we'll see you next Thursday on Cut to the Chase with Senator Chase.